Ablation is a technique to treat liver cancer. This technique uses heat or high electrical voltage to kill the liver cancer cells and spares as much of the normal liver as possible. After the tumor cells are destroyed, the tumor will eventually be replaced by scar tissue. There are size and anatomical considerations that determine if ablation can be used to treat liver cancer that is specific to each patient. Ablation is accomplished through a specially designed probe that is directed into the liver cancer. This can either be done by a surgeon in the operating room or by an interventional radiologist in their procedure suite. The specific details of the location of the tumor are discussed during a multidisciplinary review to determine which approach is best for a given patient. If the ablation is done by a surgeon, there are two approaches. Most commonly via laparoscopic or minimally invasive surgery, in which 3 to 4 small incisions are made and a camera is placed inside the abdomen to guide the ablation procedure. Surgical instruments are then inserted into these incisions, which enable the surgeon to guide the probes into the liver. The second approach is an open surgical procedure where an incision, usually on the right side under the ribs, is made. The recovery for a laparoscopic surgery is usually 1 to 3 days, and for an open surgery is 3 to 7 days. Sometimes, due to the location of the tumor, the gallbladder needs to be removed at the time of the ablation. If the ablation is done by an interventional radiologist, an incision is not required, and the ablation probe is inserted through the skin into the liver cancer using ultrasound or CT guidance. Patients may be able to go home the same day or the next day after 24 hours of observation. The risks of ablation include transient pain and rarely bleeding, infection, or injury to neighboring structures. There is a protocol your nurse will go over to include post-treatment medications for pain, nausea, and to prevent infection. Ablation typically requires only 1 treatment session and is highly effective at killing small tumors. It is most successful for tumors smaller than 3 centimeters. Survival rates for small liver cancers treated with ablation are up to 50 to 75% at 5 years, which is similar to surgical resection. Liver cancer can return in up to 50% of cases, so ongoing monitoring with a hepatologist is required, consisting of lab work and CT or MRI scans.